Let's talk a little bit about food. Now, food is very personal. I have no desire, or it's none of my business to tell you what you should eat and what you should not, but I'm going to give you some facts about the food here. Food on an average travels between 1,500 to 2,500 miles before it reaches from the farm to the plate. And therefore, it generates its greenhouse gas emissions through transportation costs, through use of agricultural resources, as well as through the use of fertilizers. And yet, around 20% of the food is wasted daily in our hospitals. Before I talk about healthcare, let's look at our own footprint in terms of greenhouse gas emissions. Uh, so every American household, besides transportation and housing, the third biggest contributor to our own carbon footprint is actually the food. Average US household generates around 48 tons of carbon dioxide in terms of greenhouse gas emissions, and around 8 tons are coming from food, almost 17% or so. So changing the type of food can significantly impact our own carbon footprint. If all of us give up meat for just 1 day a week, we can reduce the carbon emissions by almost 1 to 1.3 gigatons. And the impact would be almost equivalent to taking 273 million cars off the road. I'll say it again. By just avoiding meat for 1 day a week, the impact will be taking off 273 million cars off the road. That's a huge, I would say that's a huge undertaking, and that's a huge accomplishment if all of us can do that. I'm pretty sure you have seen the movie Mission Impossible. I'm going to tell you a little bit about emissions impossible, how our big meat and dairy industry are heating up our planet. So besides burning of fossil fuel, which contributes to around 64% of our greenhouse gas emissions, deforestation of the land leads to around 18% of greenhouse gas emissions, and 13% is coming from the agriculture industry as well as the livestock sector. The livestock sector is also responsible for around 35% of the total human methane emissions, as well as almost 2/3 or 65% of nitrous oxide emissions through the use of fertilizers or so. So growing the type of meat has a significant impact on the carbon footprint of what we are doing in terms of food we are providing. So beef and lamb, let's talk a little bit about them. Beef requires 28 times more land, 11 times more water, and 6 times more fertilizers to generate a kilogram of meat of beef or lamb as compared to any other type of food. Beef also leads to 4 times more greenhouse gas emissions on a calorie equivalent basis as compared to pork, and also around 5 times more greenhouse gas emissions as compared to chicken on a calorie equivalent basis. And the reason is simple. It is easy to grow a crop, consume it, rather than growing a crop, feeding it to the animal, and then consuming the animal. So as you can see on the spectrum, lamb and beef has a much higher carbon footprint as compared to vegetarian food or so. Diets matter. So a study was done in UK in which they found that the meat lover's diet has almost twice a carbon footprint as compared to a vegetarian diet. In fact, just by eliminating beef from our diet, we can bring down our own carbon footprint almost equivalent to a vegetarian diet or so. Since we are talking a little every time about auto industry in terms of greenhouse gas emissions, so let's talk how much 1 kilogram of food contributes to greenhouse gas emissions when we compare it with an auto industry. And so consuming 1 kilogram of lamb or beef will generate the same amount of carbon dioxide emissions as somebody who drove somewhere around 63 to 91 miles by car. And as you can see, vegetarian food has a much lower carbon footprint. So how are hospitals trying to address this anomaly? 80% of the antibiotics prescribed in United States is not prescribed by physicians to their patients. It is actually used in a veterinary industries and given to animals. And that is what is leading to the incidence of around 2 million antibiotic resistant illnesses. So many hospitals are trying to provide healthier food options by providing less meat and replacing the meat with vegetarian options. They are also planning to buy more and more of organic meat devoid of antibiotics to minimize the risk of these infections. And they are buying food locally to cut back on their transportation cost and trying to generate a sustainable economy. So many hospitals have done that. I'm going to share with you some success stories. So Chicago hospitals um, basically developed a beverage system in which they were displayed color coding technology by displaying that green beverages are the one which you should drink more often, yellow you should drink occasionally, or red you should drink rarely or so. They did not see any reduction in their revenues, and in some ways they were promoting better health or so. Gunderson Hospital tried to address the food wastage in their hospital. They found out that they were wasting around half a ton of food every week, or almost 24 tons a year. So they analyzed what they can do to cut back on their food waste. They decreased their scrap waste. They started warming soups in smaller containers, and over a course of 6 months or so, they were able to reduce 60 to 70% of the waste, leading to around $30,000 in saving. The University of Vermont started offering less red meat to their customers and replacing the servings with more vegetables and fruits. They also started growing vegetables on the rooftops, so thus cutting back on the transportation cost. And all the food that has been wasted is being sent to a company to produce compost, which they are buying it back from them, thus closing the loop. So in this way, they are delivering climate smart healthcare by providing better food, organic food, and a local and sustainable food. I'm an anesthesiologist, so I'm going to talk a little bit about greening the operating room and the impact of anesthetic gases on climate change. So around 7,000 tons of waste is generated per day in the hospitals, almost 4 billion pounds per year, and around 30% of the waste is actually coming from the operating room. 70% of that waste is considered biohazardous, even though it should not be more than 15% or so. In fact, the amount of the waste generated in the OR in one day is more than a family of four you will generate in a week or so. And simply converting from disposables to reusables, we can cut back our waste by almost 65% or so. So regulated medical waste, which is generated in the hospital, is extremely expensive to dispose of. It costs around 28 cents per pound. Now, I mentioned earlier that the total global healthcare carbon footprint is around 4.5% of the global net emissions of almost equivalent to 2 gigatons. If we look at our anesthesia carbon footprint, again at the global level, that number is around 1%. So of the 4.5%, 1% is actually coming from anesthetic gases or so, which is a significant amount. If we quantify it further, around 0.6% is coming from anesthetic gases and 0.3% is coming from hydrofluorocarbons. And even quantifying further, we use nitrous oxide and other fluorocarbons as inhalation anesthetic gases. 0.4% is coming from nitrous oxide and 0.2% from anesthetic gases. These are some of the gases which we use in our operating room. And one of the gases we use, desflurane, has the highest impact on carbon emissions because it has the highest global warming potential, almost 3,000 times more potent as compared to carbon dioxide. So if we are using these anesthetic gases just for 1 hour at a standard fresh gas flows of around 2 liters or so, the impact of using desflurane will be almost equivalent to somebody who drove 378 miles of car. So we are comparing anesthetic gases with an auto industry. And this is, by the way, just for 1 year. So if I'm providing anesthetic gases using desflurane for 1 hour at a standard fresh gas flow, the impact of my healthcare, which I'm providing, will be almost equivalent to somebody who drove from Palo Alto to Los Angeles. My typical day is typically around 10 to 12 hours. So during 1 day, my carbon emission footprint by providing anesthetic care would be almost equivalent to making 6 round trips from Palo Alto to Los Angeles. That's a significant amount. We can do better. We can do better by eliminating gases with the highest global warming potentials and using smarter technologies to cut back on our waste. And that is what we did. And that alone led to 90% reduction in the carbon footprint of our anesthetic of our department or so. If all the hospital adopted best OR practices, we can save around $5 billion in 5 years, and that we can accomplish through reduction in our energy usage by investing in smart technologies, using LED bulbs, cutting back on our waste, reprocessing or recycling, whatever is possible, and also in OR kit reformulation, so that way we don't have to use disposable items. In fact, we can save around $56,000 per operating room by adopting these smart strategies. Let's talk a little bit about energy. Now, the US healthcare spends around $10 billion on their energy needs, and they contribute to around 10% of greenhouse gas emissions. The cost of electricity has actually increased over the last decades. It was $4 per square feet almost 2 decades ago, and now it's hovering around $6 per square feet or so. If you look at the electricity usage in the hospital, around 43% of the electricity is used for lighting purposes. So if we can replace our lighting with LED bulbs, we can not only improve energy efficiency, but also can cut back on our energy bill as well. Around 5% of the energy is used for refrigeration purposes, around 18% for office equipment. So investing in Energy Star, more energy efficient devices can cut back on our electricity bill. If we look at the water usage, we use around 570 gallons of water per bed per day. Around 42% of that water is used for sanitary purposes. Around 23% is being used for HVAC purposes. Now, this water has to be heated, distilled, chilled, and all these processes lead to increased energy use. And so we need to invest in smart energy technologies. Therefore, by right sizing the fan, because fan is what every hospital used to distribute the flow of air throughout their buildings, we can increase the efficiency of the fans, and therefore we can cut back on our electricity usage and consumption. There are 3 mantras for saving. They are basically reduce, reduce, and purchase. So reduce our energy use, which addresses the demand side of electricity management, produce more renewable energy or invest in solar energy, or purchase energy through third-party buyers. And that basically addresses the supply side of electricity or energy management. Other strategies like retro-commissioning old equipment for better systems alignment, lighting upgrade, as I mentioned earlier, to LED, retrofitting old equipments, air distributions. By right sizing the correct fans, we can improve the efficiency of our fan systems, can also lead to making our system deliver more climate smart healthcare and cutting back on our carbon emissions coming out from electricity usage. These are some of the payback times when we switch to these smart strategies. So simply upgrading to LED lighting can give us a payback within 6 months to 4 years, depending upon how many lights are we trying to replace. Optimizing chiller equipments, improving HVAC setbacks, automatic computer shutdowns, and many of these things are much easier to do, and their payback time is pretty much within a year or so. So let's talk a little bit about the success stories. So Cleveland Clinic reduced the air circulating times in their operating room during non-surgical periods because circulating air requires a significant amount of electricity usage 24/7. So if you are not using the operating rooms, you can cut back on the air exchanges every hour. And by doing so, they were able to reduce their energy consumption, and that alone led to $250,000 in savings or so. Boston Hospital addressed their water usage, and they were able to fix leaks in their systems. They were able to use smart technologies for irrigation, which are more compliant with weather, so they can smartly deliver water when needed and save when it's not needed. Also investing in an on-site sewage treatment plant, they were able to not only treat the water coming out from the sewage and basically recycle that water for irrigation purposes after cleaning. Environmental preferable purchasing is also a very significant amount, uh, is a significant strategy we can use to reduce our carbon emissions, because as I said, 70% of our emissions are coming from the supply chain. So the less we use our disposable devices, the better it is for the environment, because it will generate less waste or so. Virginia Mason Hospital invested in a single-use device reprocessing plant, and they are now sending all their surgical equipments to that plant, which are now getting reprocessed and being used back again. Thus, they are cutting back on the usage of disposable devices. If any hospital is not managing their waste properly, they are wasting significant amount of resources. Around 30 pounds of waste is generated per patient, per bed, per day. And that is a lot of it. So we can address that even at source reduction um, by investing in, as I said, in disposables versus reusable strategies, recycling what can be recycled, in terms of food, composting food, so that way we can not only avoid fertilizers, but also can be used back again to grow our food. So these are some of the strategies we can use to cut back on the waste. In terms of the percentage of waste, majority of the waste is solid waste, which is easy to dispose of and doesn't cost too much. Regulated medical waste and hazardous waste, even though they constitute 8% of the weight by volume, but they unfortunately eat up 55% of the hospital waste budget. As you can see, the median cost by waste type, hazardous waste cost around $4,500 to dispose of. Regulated medical waste cost around almost $1,500, around $1,000 to dispose of or so. So many hospitals are trying to address the waste by not only increasing the recycling rate, better education, so what goes where, trying to cut back on the regulated waste or so. And that way we can provide a better and a climate smart healthcare. Now, hospitals have to provide healthcare even in adverse weather conditions. Typically in US, we receive around 10,000 thunderstorms every year, almost 1,000 tornadoes or 10 hurricanes. Hospitals still have to run even in the times of climate adversities or so. Majority of our acute care hospitals have a lifespan of around 31 years. So the new hospitals are being designed keeping all these factors in mind to have at least a lifespan of more than 50 years or so. So they are using smart technologies like rainwater harvesting, having an on-site sewage treatment plant, investing in renewable energies. All these things are adding another layer of resilience so they can sustain themselves at the time of weather crisis or so. Kaiser is a classical example of how a climate smart healthcare can be delivered. They applied for LEED certification, which stands for Leadership in Environmental and Electricity Design. It's the first Kaiser hospital who received that certification by investing in certain upgrades, which cost them around $170,000, almost less than 1% of the total medical center cost of construction. They were able to use smarter technologies that allowed them to use 27% less energy, 35% less water. Most of their energy is coming from solar energy, renewable. And in 2020, they became actually carbon positive, which means they are giving energy back to the grid. The payback time for making all these changes is less than 5 years. So that is how a climate smart healthcare can be delivered by addressing every single aspect of our carbon emissions. Transportation is another area which can be addressed, and many hospitals are working on providing incentives for either share rides, investing in hybrid technologies or electric vehicles, changing the fleet of their own vehicles to run on hybrid technology, and therefore cutting back on their carbon emissions generating out from transportation. Leadership is an extremely important aspect of what we do. Whatever I have said so far will not accomplish anything if our leadership is not invested in it, because our core values are deeply ingrained in our decision making process. So it is very crucial for a leadership to believe in these missions to get the best success and to provide climate smart healthcare. And that's what Kaiser has done to accomplish these objectives. So in the end, I'm going to summarize that what can we do to provide a climate smart healthcare? Well, we can do a lot. We can cut back on our energy usage by investing in energy efficient technologies, investing in solar panels or renewable energies, cutting back on our anesthetic gases, trying to reduce our waste by encouraging recycling of what can be recycled, educating our colleagues about what goes where in terms of waste generation. Also, trying to serve organic meat, less meat, replace that with vegetarian food, and educate our community. These are some of the ways we can deliver a climate smart healthcare.